Welcome, everyone. I'm really excited to be able to welcome you to our very first of the MSSU Presents new webinar series that we have started. And this one is Data Services in New Brunswick and Nova Scotia. I am Sharon Scaling, and I am the Capacity Development Coordinator for the MSSU, and I work out of the Halifax site, and I'm happy to welcome you today. I want to acknowledge that we are in Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq people. This territory is covered by the Treaties of Peace and Friendship, which Mi'kmaq and Wolaski people first signed with the British Crown in 1725. We are all treaty people. People in. We also recognize the histories, contributions, and legacies of the African Nova Scotian people who have been here for the last 400 years. Really excited to be able to introduce three of our presenters today. We, in the past, have done just with HDNS in Nova Scotia, but now we are happy to include New Brunswick in our presentation today. So we have Afton Levine, who is a data access coordinator with the New Brunswick Institute of Research, Data and Training. We also have Megan Pike, data transfer coordinator from the New Brunswick Institute of Research and Data and Training, and Caitlin Frizzell, who is our data navigation manager from Health Data Nova Scotia. And so I think we're going to get started. I'm just going to change my view, and hopefully we will be good for Caitlin. Can you see the screen okay?
Yeah, I can see it.
Okay, that's great. And so we are going to get started. I just need to fix my view here a tiny bit so I can see the notes. And I believe we're going to be starting with Megan.
Hello, everybody. Thanks for spending your lunch with us. My name is Megan Pike. I'm the data transfer coordinator at the New Brunswick Institute for Research, Data and Training here in Fredericton. And Afton, my colleague, and I, Afton Levine, will just go over sort of our day-to-day with everybody. Next slide, please, and thank you, Sharon. So to begin, we would like to respectfully acknowledge that UNB stands on the unsurrendered and unceded traditional Wolastoqey land. The lands of the Wabanaki people are recognized in a series of peace and friendship treaties to establish an ongoing relationship of peace, friendship, and mutual respect between equal nations. Next slide, please. Today, we will discuss the roles that data services play at the New Brunswick Institute for Research, Data and Training, highlighting our various data sets and projects types, as well as the data access request and approval process. Next slide.
So I'm going to kick things off with a little bit of a brief history. NB-IRDT was established in 2015 as a research data center. We are a data custodian offering access to administrative data sets that can be linked and placed in customized project folders. Earlier this year, our operational agreement was renewed, so we can continue to operate. We are very excited about that. NB-IRDT provides access to linked pseudonymous data for research via our data platform. So pseudonymous data, that means that direct identifiers such as name, Medicare number, social insurance, etc., those have been removed, but indirect identifiers remain intact. And we also have a trusted research environment. So the slide says secure research environment. So there's a slight little, we recently updated our terminology. So rather than now saying secure research environment, we are going with trusted research environment, which is more in line with industry standards. So forgive us if you see SRE or secure research environment in our slides. We do mean trusted research environment, or the TRE. So the trusted research environment is a controlled access location that is where our data is stored and accessed. We have 3 physical locations, one being in Fredericton at the UNB campus, one in St. John at our UNB St. John campus, and we also have one in Moncton at the Université de Moncton campus. We are actively working on having remote access available, but right now it's only physical access. You have to be in New Brunswick at one of our 3 locations to access our data. Next slide, please. So this is our research team. They're not research team, our data services team, sorry. We actually have 7 members. There's only 5 pictured there. We recently hired a manager, Santosh Janakariram is our new manager, and he oversees our whole operations and provides advisory support to our team. We also have our data privacy officer, who is Donna Curtis-Mae, pictured here. She advises on privacy breaches and does reviews for our data requests. We have our database administrator, Ziquan Liu. He is our data guru, basically. He knows everything about the data. He's the person who would be actually, once your project is approved, putting the data you've requested into your project folder. We also have a data navigator who is not pictured here. That is Ali Bakesadia. He is we share him with the research team. So he is a senior data analyst as well, but then he also has a percentage of time that he dedicates to the data navigation. We have Carla Hovey, who is our data services coordinator. We have Megan Pike, who is our data transfer coordinator, and myself, Afton Levine, who is our data access coordinator. So we offer support throughout the life cycle of the data life cycle, through the whole process, from collection all the way through to disposition. Next slide, please.
So in its simplest form, we hold 2 different types of data at the Institute: platform data and project data. Platform data is our largest data type. The NB-IRDT platform data holdings cover a range of research topics, including, but not limited to, education, health, environment, and immigration. All data on the NB-IRDT platform are de-identified and most are linkable. Project-specific data are transferred to the Institute for a specific project. It will be returned or destroyed upon completion and subsequent project disclosure. A third type of data we hold in our secure facility are data which are held for project use but do not require linking. But before transferring any type of data to our trusted research environment, the appropriate data sharing agreement must be in place. And that's sort of my main role, is I help ensure that those agreements are executed in accordance with the project guidelines. Next slide, please, Sharon. So as you can see, NB-IRDT holds a vast number of platform data sets. These data are available for project use following the completion of the data access process. To briefly highlight, the Institute holds a substantial amount of health data from the province. These data cover everything from the Drug Information System, the Discharge Abstract Database, and data from various cancer screening and research databases throughout both the regional health authorities. And our education holdings, for example, include data on education and early childhood development, as well as post-secondary education, training, and labor in New Brunswick. Next slide, please. So data services is uniquely positioned to be able to advise on the entire life cycle as a team. So together we can facilitate data transfer and project approval simultaneously. Accessing data through the NB-IRDT platform allows researchers to answer their research question. And with having more than 125 platform data sets to choose from, we encourage you to visit our website to explore our holdings. Research collected data with proper consent can also be linked to the administrative data holdings at NB-IRDT to answer a research or policy question. So that's something else that we are able to do. Next slide, please. Importing or transferring data to NB-IRDT does follow an approved process that all data business owners must adhere to when transferring data to our trusted research environment. After the appropriate agreement has been executed, the program data are transferred to the Institute via one of only 2 approved methods. Data are placed on an encrypted password-protected USB and are either hand-delivered or express posted to the database administrator. The password is then delivered via telephone at a separate time. This helps ensure that all privacy principles are followed. Upon completion of the crosswalk file, that is also hand delivered by our colleague at the Department of Health to our database administrator, because we are not online. Upon delivery of both files, the database administrator initiates the intake process, which upon completion allows the data to be available for project use. Data are accessed via the project folder once all data access approvals are met. Afton will now highlight a data access at NB-IRDT. Next slide, please, Sharon.
Mute. There, forgot the mic. So we have 4 different data access project kind of types that we facilitate here. The most common that we receive is retrospective, which is looking at data from the past. We also have multi-phase projects. So this would have 2 phases to it. The first phase would be when the research team maybe has to do some primary data collection, and then they want to link that to the administrative data. So phase 1 is the actual collection of the data, and then phase 2 is when they're ready to link it to the data on the platform. We also have prospective longitudinal, which means your project is going to look into the future. So we're going to have to do amendments once we have the actual data in the future to be able to give to you for your project. We also have successive projects, which is basically one research project that would have like one component changing of it, or one element changing. So like the whole series of the project would be examining a different disease, maybe for a different same cohort with a different disease, basically, is kind of what I'm thinking of here. NB-IRDT is also a member of HDNS Canada, and as a member, we also organize and facilitate multi-jurisdictional data access requests through the Data Access Support Hub. Basically, they are treated the same. Any of the multi-regional requests could be any of these 4 types. Once we receive it, we receive what kind of type it is, and then we process it the same as all of them. So we can dive now into the approval process. Next slide, please, Sharon. To start, we do offer consultations. This isn't a mandatory step, but if we receive just a random email about maybe our data holdings or a potential idea for a project, we will set some time up and do a consultation with you to discuss the possibilities of working with us and seeing what data we have that would be informative for your project. After that, we would recommend that you submit a feasibility request to us. So the next step is a feasibility request form. Once we have reviewed that, we would send along the feasibility results to you and provide a checklist of all the items that we're going to need to be able to continue processing the request. Next slide. The next step in the approval process is actually receiving the data access request form. So once we receive this form, there are 3 reviews that take place. We have an institute review, which is a preliminary internal review. Some of the same people who would have done the feasibility review would be looking at it just to see if any edits needed to be done, and then they would move it on to our DRC, which is the Data and Research Committee, which is that is a group of the data business owners. We have some public partners also on it, and then members of NB-IRDT also are on that group. So we meet with the research team and discuss the project. It gives the research team a time to ask the data business owners direct questions about the data, and vice versa. The data business owners can talk and ask certain questions about what they're wanting to get out of the data to help inform what variables might be needed and things like that for the project. Once that is complete, we have a newer, I guess. It's been around for a few months now, but we have a preliminary ethics review committee. This is a step that we implemented. We found it quickened the REB process. So we worked with our REB people to develop this committee, and it's just an initial review to make sure that everything is in line for the REB. And generally, all of the REB requests go through a delegated review. Since we implemented the PERC process, we found that the turnaround time for REBs can be as quick as 3 business days. So that's we're very excited about this development, and it's really helping move things along very well. Next slide, please. After the PERC has been completed, we receive the updated data access request form from the research team, as well as all of the REB documents that went through the PERC process, and we submit the package to REB on your behalf. There'll be a delegated review, typically, like I mentioned, and then the REB chair will send an email directly to the PI and CC our office once the REB has been approved. As soon as REB has been approved, or as soon as I receive notice that REB has been approved, then I prepare the data access agreement. And this is the legal agreement that's between the research team, the principal investigator, and UNB's Office of Research Services. So I prepare the data access agreement and I send it to the Office of Research Services. They review and sign, and then it goes to the PI for them to sign. If the PI is not from UNB, from say Dalhousie or U2M or a different organization, there's a specific institution to institution agreement. So in addition to the PI needing to sign, somebody like a signing authority from the PI's institution would also need to sign the data access agreement. Once that has been fully executed, I prepare a welcome letter and package for the principal investigator. And then we ask for our database administrator, Zequan, to prepare the project folder for the team. And then he lets everybody know once their user accounts are ready and they can begin accessing the data. Next slide, please. Megan, over to you.
I started with my mute on, sorry. So to finish up, I guess, data services at NB-IRDT can help you conduct your own analysis. We provide contracted analytical services for your project if you need it. We help transfer data to our platform, or we provide a secure storage facility for collected data. Next slide. If you have any questions, please feel free to reach out. I'll now hand it over to Caitlin from Nova Scotia, and thanks everybody for their time.
Thank you so much, Afton and Megan. And we will have time after Caitlin's presentation for some questions as well, is our intention. So thank you, and over to you, Caitlin.
All right, thank you. Yeah, so we'll jump into the Health Data Nova Scotia portion of the presentation. So like Sharon said, I'm Caitlin Frizzle, and I'm the Data Navigation Manager at HDNS. Next slide. So in today's portion of the presentation, I'll provide an overview of HDNS and the services we offer. We'll also describe the data we have available and outline how a researcher can apply to access the data, while also providing some tips or tricks or important things that researchers need to consider when applying. I'll also discuss how the data is accessed and analyzed. And then lastly, I'll briefly go over the process for applying for data access in multiple jurisdictions. So there's a group that can help with that, and I'll introduce them in the end of my presentation. So Health Data Nova Scotia acts as an agent under the authority of DHW. So we're a bit different from New Brunswick there. So we aren't the custodians of our data. The custodian is the Department of Health and Wellness. So the data custodians are defined as the organization who has custody or control of the personal health information. So that's Department of Health and Wellness in Nova Scotia. So HDNS is a unit of Department of Community Health and Epidemiology at Dalhousie University. Our unit was first established in 1993 and used to be known as the Population Health Research Unit, or FRU. And we're also closely partnered with the Maritime Spore Support Unit. So for example, some of our internal staff, like myself, were hired through MSSU and then were embedded in HDNS. Next slide. So here I've listed everyone that makes up the HDNS team. This picture was taken a couple years ago at a holiday lunch. Our HDNS director is Dr. Sam Stewart. He's an associate professor in the Department of Community Health and Epidemiology at Dalhousie as well. Lindsay is our HDNS manager. She oversees the general operation and management of HDNS, and she also acts as the chair of our Data Access Committee. Sandra is responsible for developing and monitoring the compliance program and ensuring that the activities of the unit meet regulatory requirements. Sandra also manages our financial portfolio. In my role, I support the data access process or support researchers through the data access process. And I provide data navigation for databases and their variables and coordinate amongst researchers and analysts and various data access committees. Yoko acts as both a data analyst working on data pulls and analysis and also a data documentation specialist. So she makes sure our data dictionaries are up to date. And then Liwei and Yan are our two senior data analysts. They both have years of experience working with the HDNS data and performing analyses. Eve is our systems administrator, so he looks after updating the data on our platform and giving access to the data when needed. And then Shuan acts as both a data analyst and a data navigator. So she works on data pulls and analyses, and she also helps coordinate projects through the data access process. And then we have 5 consultants as well who help us out from time to time. Next slide. So our main commitment at HDNS is to facilitate research and innovation in Nova Scotia by providing access to linkable administrative health data and analysis for research and health service assessment purposes in a secure, controlled environment while respecting the privacy and confidentiality of Nova Scotians. So our secure remote environment is called Citadel, and I'll discuss that a little bit more later on in the presentation. Next slide. So this slide shows our main administrative databases at HDNS. We also have a database for dental visits that are covered under insurance and a long-term care registry that identifies if and when someone moved into long-term care. And then we also have 2 new databases that I'm going to discuss in the next couple of slides, but I'll go over these a bit more in detail on this slide. So physician billings, that contains data information on any healthcare encounter that were billed to Medivy. So this database, it also has information on shadow billing too. So, and if a salaried physician who works in the ED emergency department, for example, they would also report some of their visits through physician billing. And then there's also information in there like the dates of doctor visits, the diagnoses determined during that visit, and information on what the encounter costs. And then below that, we have the insured patient registry. So this database is required for most projects. It contains demographic information. So that's provided when health cards are renewed or, and then it also contains eligibility information. So the start and stop dates of insurance coverage and postal codes of where an individual has lived over those dates. In the bottom left there, we have the licensed provider registry. So that one contains information on the licensed doctors in Nova Scotia, including their specialties they received in school, their demographic information, where they graduated med school, etc. In the middle, we have our CIHI databases. So that's the Canadian Institute for Health Information, the Discharge Abstract Database, and the National Ambulatory Care Reporting Systems. So CIHI DAD contains detailed information about hospital admissions, like diagnoses and procedures in hospital, the length of stay, the admission and discharge dates, what hospital they were in, if they were transferred, etc. And then CIHI NACRS contains information on day surgeries done in hospital, and it has limited information on emergency department visits. So the emergency department data is limited because only a few hospitals in Nova Scotia actually report their ED visits through NACRS, so that's a bit of a limitation with our data. And then moving over to the right is the Seniors Pharmacare. This database includes variables related to medications prescribed to individuals age 65 and over who are enrolled in Seniors Pharmacare. We also have a Family Pharmacare, which is similar for those enrolled in that pharmacare program. Below that is the Drug Information System database. This one contains information on all prescriptions filled in community pharmacies, and that one's quite new. It didn't start until November 1st, 2016, and doesn't include prescriptions filled in hospital, but has all of them that are filled in community. And below that is the vital statistics database, and that contains death information. So that would be things like date of death, causes of death, underlying cause of death, for example. And then for dates of availability, so NACRS didn't roll out in Nova Scotia until 2011, so we only have data back to then. However, the other databases start in the late 80s, 90s, and the Medivy databases are currently updated to June 30th, 2024. CLI are updated to March 31st, 2024. DIS is to June 30th, 2024. And Vital is only available till December 31st, 2021. So that one lags a little bit. And these dates are always updated on our website as well. So in 2024, this past summer, we've added the Canadian Longitudinal Study on Aging, or CLSA, data to our holdings. The CLSA study is a large national multidisciplinary study that includes questionnaire data collected from about 50,000 individuals who were first recruited between the ages of 45 and 85. Of those 50,000 individuals, 4,500 are Nova Scotians. So this data includes information on the individual's physical and mental health, their activity level, their social status, economic status, etc. The baseline recruitment for CLSA started in 2010 to 2015, and follow-up started in 2015 and occurs every 3 years until 2033. So there are two different cohorts in the CLSA data. The tracking cohort contains data collected from more than 20,000 people through computer-assisted telephone interviews. And then the comprehensive cohort contains data collected from more than 30,000 people who had in-home interviews and visited data collection sites. So in Nova Scotia, that would be the one in Halifax. And then I popped the link in there to their website where you can learn more about that project. Next slide, please. Yeah, so also in 2024, we had the Atlantic Path data added to our holdings. So Atlantic Path is part of a large study called CanPath, or Canadian Partnership for Tomorrow's Health. And that study involved following the health of 330,000 people for 30 years. And of those individuals, 34,000 are based in Atlantic Canada. So the data through Atlantic Path includes questionnaire data on health and well-being of the participants, and it also includes biosamples. So that's blood, saliva, urine, and toenails. And Atlantic Path participants also provided physical measurements like their height, their weight, and their blood pressure. Baseline recruitment for Atlantic Path occurred between 2009 and 2015, and they had follow-up between 2016 and 2018. They also had COVID questionnaires completed and blood spot samples collected between 2020 and 2023. And the questionnaire data across the country, including Atlantic Province, is also held at CanPath. So in 2025, Path will be going back out to the field to collect questionnaire data. And for more information, you can visit the link there to their website, or you can contact the Atlantic Path Research Director, Ellen Sweeney, and her contact information's there. And for both the Atlantic Path data and the CLSA data, HDNS will house that data, but applicants will need to have data access approval from the data custodians in addition to HDNS. Next slide. So I've just showed how external data is linked at HDNS. So the linkage variable is the health card number. So HDNS doesn't house real health card numbers. We only have encrypted health card numbers for individuals. So anyone sending data to us, so for example, EHS, they would need to send the health card number and a study ID to Medivy Blue Cross, and Medivy would encrypt that health card number and then send HDNS the encrypted health card number and the study ID. And then EHS would also send the study ID and then all the research variables along directly to HDNS, and that be done during using a secure file transfer. And then within HDNS, we would link everything back together using the study ID. So this linkage process is followed for most projects unless they have a very complicated type of linkage. Next slide. So pharmacists have been able to prescribe medications for more than 10 years in Nova Scotia, and this ability has increased over the last couple of years. So this is an interest in Nova Scotia for research projects. So one example of how our data has been used in the past is to identify pharmacists using the prescriber type variable in the provider registry. And then we link those pharmacists to the drug information system using a prescriber ID. So this linkage can be used to show how pharmacists are prescribing medications, so what medication they're prescribing and how frequently they're prescribing. And then we can also link the patients they prescribe to. We can link them back and look at their demographics and their healthcare use in the physician billing or Kai Dad, for example. So that's a common type of project that's been done at HDNS over the past couple of years. Next slide. So getting into applying for data access. So at the beginning of our project, the researcher will usually contact a data navigator like myself or Shuan to discuss their project and how we can help. The next step would be to complete our feasibility and cost request form. So that form includes things like the description of the study population, if external data will be linked, if they need us to perform analysis for them, for example, and then a senior analyst will review that and determine how many hours each step of the project will take, like the cohort creation, data extraction, data analyst. And then we will send a quote back to the researcher. And then if they decide to move forward, they can apply for funding or start to go through the data access process, which includes applying to the Research Ethics Board. And that for HDNS, we would need the researcher to apply to either Dalhousie REB, the Nova Scotia Health, or IWK REB. Next slide. So that brings me to the data access request, which the researcher submits to the data access committee at HDNS. So before they submit, it's recommended they discuss their project with a team at HDNS to determine what data we can use to answer their objectives and go through the data access request form step by step. Once the data access request form is ready, the data access committee will meet to review. So the researcher should attend that meeting to answer any questions that the committee has and to give an overview of their project. So I'll break down the data access committee and that data access request form a bit in the next couple of slides. So the responsibilities of our data access committee center around protecting the confidentiality of personal health information and the privacy of the individual who is the subject of that information. So we currently have about 14 members who have expertise in different areas such as privacy, implementation science, and biostatistics. And this includes representation from Department of Health and Wellness, Nova Scotia Health, and NB-IRDT. In 2023, we welcomed 2 patient public partners to gain insight from the public perspective on our data access requests. And then our decisions are made by consensus. If a project is considered minimal risk, then only the data access committee chair and 1 or 2 other members will review. Next slide. So our data access committee meets the first Wednesday of every month. Prior to these meetings, we ask that submissions are sent to us 2 weeks in advance for a preliminary review, and then materials are sent out to members 1 week before the meeting. So the full submission to the Data Access Committee contains the completed data access request form and accompanying appendices, a full Research Ethics Board submission, and a research protocol. So although we require a full REB submission, The approval is not required for a project to receive data access approval. In fact, some of the Research Ethics Board now require HDNS approval before they can approve. So it's kind of a tricky situation on how to know what to do first. So it's good to do both at the same time, but maybe not submit the Research Ethics Board submission until the HDNS has reviewed. And then the HDNS analysts, they don't start working on the project until REB approval is received. So it's good to get that in quick. Okay, so here I've added some common tips or tricks for a successful submission. So to start with, like I said before, it's recommended to meet with a data navigator like myself or Shuan to go over databases or variables, and also to review the data dictionaries to become more familiar with what data we have available. It's also recommended to have clear objectives and detailed methodology so we can help determine what exactly you will need for your project. And then I've listed some common mistakes. So there's a question in our data access request form that asks about what the risks are to using the data and how those risks will be mitigated. And a common answer is that there's no risks because it's de-identified data, but that's not right. There's always a minimal risk of re-identification. And that's why we have rules like not allowing cell sizes less than 5 to be reported and requiring anyone accessing the data to complete privacy training. Another common mistake is not providing enough justification on why the data is required for the project or why consent wasn't obtained. For consent, the most common answer is that the population size is too large to ask everyone to consent to the project, because some of these projects include everyone in Nova Scotia, for example, so that would be pretty near impossible to do. And then other issues include not listing all the variables required for the study and improperly describing how the data will be linked. Next slide. So I've just added a screenshot of what the template for the variable list looks like in our form. So it's just to show you the level of detail we're looking for. So the last 2 columns here, you need to kind of provide a justification of why the certain variable is needed for your project. And that's what we use to determine the risk or privacy risk in the study. Next slide. So after the Data Access Committee reviews the project, the researcher is sent a list of clarifications to address, and then they will resubmit that for approval. Then they'll need to sign the data access request form, and they'll need to send us the REB approval. They'll also need to sign confidentiality agreements and a contractual agreement for data access and management. And then anyone accessing data and the principal investigator will need to complete privacy training and send us their CVs. And then the analyst assigned to the project will start working on the project charter, and that outlines all the work the analyst will do on the project. So that's the cohort creation, project deliverables, payment agreements, etc. Yeah, back another one. Yeah, that's good. Back one more, Sharon. All right. All right. Yeah. So So lastly, I'll just talk about how you access the data. So the data server is physically located in the Killam Library on the Dalhousie campus, and it's accessible on our remote secure environment we call Citadel. So you'll access the data through a remote desktop connection while being connected to the Dalhousie network or the Dalhousie VPN. And that requires the person accessing the data to have a Dalhousie Net ID. If they don't have one, we can request one for them. And then when connected, it looks like a regular Windows desktop, but there's no internet connection and you can't copy and paste any of the data off of Citadel. And then when you want the results exported, you would need to contact Eve, our systems administrator, and he'll vet the results to ensure no cell sizes less than 5 are being exported, and then he'll release that to you. And then on Citadel, we also have SAS, Data, R, and Python, or RStudio, I guess. So analysis can be performed on there. Analysis can also be done entirely within HDNS. So researchers don't need to access line level data themselves. We can do the analysis for them and provide the study results or the aggregated data. All right, so next slide. All right, so just switching gears here for the next section to talk a bit about what you do when a project involves multiple provinces. So Health Data Research Network Canada has a group that can help you through that process. Next slide. So Health Data Research Network Canada was created with the mission to bring together people and organizations across Canada for transformative and world-leading health data use. So from this, they created the Data Access Support Hub, or DASH, to target the strategic goal of developing and improving services to support data access across Canada. So DASH was first launched in 2020 and offers a centralized resource for researchers requiring data from 2 or more of DASH's 13 member organizations across Canada. So that includes HDNS, and it also includes NB-IRDT and the Secure Island Data Repository on PEI. DASH will coordinate these multi-jurisdictional requests and facilitate communications between the research team and each data center that's involved in the request. So DASH doesn't hold data itself. It's all held within those data centers because each province has their own legislation, like the Personal Health Information Act in Nova Scotia, and they all have policies regarding data access. So DASH has created streamlined processes, providing better support and coordination for researchers with these multi-jurisdictional requirements. They've developed different resources like data asset inventory, which lists data availability at each center. They've developed an algorithm inventory. They also have lists of privacy and ethics considerations for each data center, and they have a centralized data access request form. Next slide. So here's an overall picture of what the DASH process looks like from the first point of contact to data delivery. So the first step would be to complete the DASH intake form, and that contains high-level information about the requests, such as brief background of the study, the types of data the researcher is looking for, and what data centers would be involved. And then DASH will send that information off to each of those data centers and ask for confirmation of feasibility, eligibility, and cost estimates. So that step usually takes about 2 to 4 weeks and involves internal meetings or meetings with the research team. And then when the research team is ready to move forward, they complete the new single data access request form, and that's taken back into each research center and reviewed. And then once the data is ready, each center will make the data available or provide the analytical results, whatever the researcher needs. So that's just a very high-level overview of how DASH works, and I've popped in the link there as well if you'd want to learn more about their process. Next slide. Yeah. All right, so thank you, everyone, and be happy to take any questions.
Wonderful. Thank you so much, and my apologies for the slipping with the slides, I'll say. That was a cat.
Oh, that's okay.
So yeah, I thought my apologies. So yes, we're thank you for Afton and Megan and Caitlin for that fascinating presentation. It is all Greek to me, but I'm sure some of the researchers may have some questions. So I ask if you could either probably put your hand up if you'd like to ask a question, and I can call on you. Yes, go ahead, Steve.
Mic was off. Sorry about that. Yeah. Hi, thanks for the presentation. It was really good from both organizations. Really interested to learn the holdings that you have and the data sets. It's quite impressive, actually. I'm with the Public Health Agency of Canada. Obviously, we're not a university. We're not a research organization. I mean, we do some pretty high-level research and analysis of our own, but it's nothing in at the same level of the academic industry and the academic universities and stuff. So we don't quite do that level of research. However, you know, one thing we struggle with a lot is access to just basic health data so that we can do analyses, whether it's, you know, surveillance or, you know, looking at infectious diseases, chronic diseases, things like that. We could always use better access to data. And I don't have to tell anyone here how challenging the Statistics Canada website can be to get that, to get the stuff you need. It would be ideal if we could, you know, have some sort of agreement or some way that we can access some of the data holdings that both of these organizations have. I understand the application process and the level of rigor that needs to be done to protect the privacy of the data, and I have I completely understand that. I'm just wondering if that's something that you have done with other government organizations, either provinces or other federal departments, whether you have provided data to them, and if not, is that something that can be explored?
Yeah, so that's a big issue for all the data centers. Is it's sending data out. So we can't really send data out of our environment. We work as an agent for Department of Health and Wellness, so it would be their final say if they were okay with us sending data out. But that's a common issue amongst all provinces for projects that want data all in one place. It's not really possible right now. It's just we struggle a lot with that. We talk about it a lot. Yeah.
Yeah. All right. Yeah, I understand.
Afton, were you going to say something?
I would just kind of echo what you said. Yeah, like data pooling is the key buzzword that lots of people like to use, and we're not able to do that. So any analysis, like for the multi-jurisdictional requests, for example, they take place like in each of the provinces, and then maybe the aggregated data is what's shared out of the province.
Sounds like it's an ongoing issue. Yeah.
Yeah.
Great.
I mean, aggregated data would meet a lot of our purposes, but yeah. Anyway, I'll keep that in mind. Maybe we can figure something out in the future. Thank you.
Great. Thanks, Steve, for your question. I see that Afton, you answered something in the chat. I saw that Charlene did have her hand up, but now she's added something to the chat. Is there anything on either website that shows what data variables we could possibly get, or is that all done through a request?
You can visit the NB-IRDT Holdings website. Afton actually put it in the chat. That has it has descriptions, what we call the data information card, has all of our data set information as well as the variable list and code book if complete and available. If there are items on the website you have questions about, that's what you can reach out to our team over. And just to speak to the initial question, for the elapsed time between sort of request for data and receipt of data, it just depends on the data set. It depends on, you know, the data business owner, the project. For us to sort of try to, you know, say an estimated time of arrival or elapsed time, it's quite tough in that sense.
Yeah, I was just going to type in the chat. I can say it really depends on how detailed and how complex the request is, how many data sets, if there's external data, linkage, things like that. But in general, like we ballpark it like 3 to 6 months, and that's from kind of data access request being submitted to us to the time that the data access agreement is signed.
Which is separate from the last time of getting data here, just because sometimes that can be much quicker and sometimes it can take much longer depending on the scenario.
Right. Thank you. Ruth Ann, I saw. Go ahead. Oh, sorry, Caitlin. Go ahead, please.
Yeah, just to answer Charlene's question about where to see the variables. So on HDNS doesn't have a dictionary website. We're working on that. So our data dictionary, I can send it to anyone who wants to see that. So that just contains a list of all the variables available for each database.
Ruth Ann had her hand up. Do you still have a question, or has it been answered with the conversation?
Well, this is a little bit to the side. It's getting back to multi-jurisdictional issues. So I've worked with data in multiple jurisdictions. I just moved back to Nova Scotia after a decade or 3. And so I've worked in other jurisdictions. And so we've dealt with the, analyses in parallel and the sort of meta-analysis later. But I was wondering if you think there will ever be a time where, a federated model where you are able to use the tools that allow concurrent analysis, from essentially your central server that's connecting with the provincial servers, which allows them to stay in their, homes, but allows you to get around some of the challenges when dealing with meta-analyses of rare diseases or exposures, where you end up with small cells that it's actually very difficult to be able to do meta-analysis with, because you have to suppress, the information can't leave. And whether you think that might be a solution, or what others are being explored to deal with the sort of complexity of the multi-jurisdiction issue at the analytical level.
I know there are discussions higher level about federated analysis, but I don't know where they are in that discussion. I guess it is something that we could inquire about and send out information about it if we're able to. Yeah.
Thank you. What I'll do in terms of the data dictionary, if you, Caitlin, just send that information to me, I'll send that out when I send the evaluation and everything out. There is a couple of questions around, there was a question around cost. Is there a cost associated with assessing the data only, not analysis by the team?
Yeah, there is a cost associated because our analysts take time to create cohorts or pull data from multiple databases. So it does take time to put together the data set for you to analyze yourself. So yes, there is a cost associated with that.
And that's the same in New Brunswick as well. We do.
Yeah. I will note that any of our MSSU associate scientists do get a discount. They get a 10% discount. So if you are a scientist, take advantage of that. And if you're not sure what an MSSU scientist is, you can visit mssu.ca, or you can reach out to me and I can give you more information around that. It's for researchers who are involved in patient-oriented research and want to support the MSSU's mandate. And is the data only available to academic and government? What about industry and pharma?
So
go ahead.
Okay. So at HDNS, we require a local PI. So we've had projects with industry before, but they've kind of still been considered a research project because there'd be a local principal investigator at Dalhousie taking responsibility for that project. So the answer is kind of yes and no of working with industry in Nova Scotia.
And in New Brunswick, we don't have the local PI requirement, the same as Nova Scotia. So the PI can be from anywhere, and including pharma. We have worked with pharma projects before. In those instances, though, the PI, it was a joint kind of venture with NB-IRDT and the pharma team. So the PI was an NB-IRDT, usually a staff scientist or researcher. But yeah, so we can work with pharma for sure, or we've had other organizations as well.
Yeah, in terms of our holdings, we hold almost 130, and not all of them are academic, not all of them are government held data. So we're always open to broadening our platform. That's for sure.
Great, thank you. I have probably just time for one more question, and that is for Nova Scotia. Is my understanding correct that data transfer is not allowed and analysis only by remote execution of script?
Yeah, that's right. So when you're approved for data access, we don't send anyone the data. We would just provide access on our remote secure environment, and then you could analyze the data on there. But we can have data sent to us, like I mentioned in the presentation, just not sending it out.
Thank you. Any other questions? One last question. looks like we've got things covered. Wow, that was great. Awesome.